Chapter 1. How to set up the patient in Protec. Have the patient grab the rope high and rotate 180 degrees while having the patient sit. Adjust the seat to a proper height for the patient. They must be seated snugged against the back. The proper height is when your hand can clear between the lower arm cushion and their hip. For a patient with acute lower back pain, ask them to hold the ropes until the arm cushion is tight and closed. The upper arm cushion shouldn't be tightened too much, but the lower cushion should be tightened firmly. While the upper cushion is being closed, ask the patient to hold their arms crossed across their chest. Adjust the leg strap so that the femur is parallel to the ground. Now, lock the pulley unit by snapping the rope into it. Use the remote control to lower the seat and then further tighten the lower arm cushion. If the patient is feeling uncomfortable, lower the seat only so that it is just barely touching their glutes. Ask the patient what knee height is most comfortable for you. At this time, it is not necessary to have their knees parallel to the ground. Do not pull the belt. You must push the cushion while pulling the belt to tighten it. Chapter 2. Wrong way of fastening the arm cushion. Here, there's too much space between the lower cushion and thigh. Chapter 2. Wrong way of fastening the arm cushion. In this example, the seat is too high. The physical exercise is constrained by the cushion. Chapter 3. Tightening the cushion harder. The lower arm cushion must be tightened securely. Ask the patient if it is too tight and adjust accordingly. Chapter 4. Self-exercise. The PT or DC should check how relaxed the patient is. When you can confirm that the patient is relaxed, have them do the swinging themselves. However, if there is any pain associated with the exercise, they must stop the swinging. If the patient is not experiencing pain, continue to do the same exercise. Chapter 5. Self-training. It's kind of like a swing in a park. Here, we'll show you how it's done. You swing in and then out. Have them do the swinging themselves. Chapter 6. Pelvic approach. Make the hamstrings straight without bending the knees. Feel the pelvic muscle to see if it is relaxed. Then, change the angle to a higher degree and ask where the pain is coming from or starting. Try 10, noon, and 2 p.m. positions for the foot and find a comfortable position. Find out what angle the pain is reproduced in the patient while pushing anterior to posterior and left to right. Try to stay parallel to the long axis of the femur bone. Find the angle that has the most tension and apply the same pressure. If the patient is experiencing a lot of pain, stop. Continue the treatment otherwise. This motion should be very rhythmical. Push, push and pull into the pelvic area. This is a similar exercise, but on the opposite side. Chapter 7: How to treat a displaced disc. This treatment is very effective for disc issues. Pushing anterior to posterior will help with most disc conditions. Next, push while the patient is placed on each side. Make sure to ask the patient if they are experiencing any pain when performing these maneuvers. Stop the exercise if the patient is feeling any discomfort. Please look over the videos to observe how these steps are taken. Chapter 8: Hip Injuries. If the patient is having hip or pelvic issues, make sure the lower cushion is firmly tightened. This will help reduce some of the pain in that area. Put the patient's foot in internal and external positions and apply pressure anterior to posterior along the long axis. While applying pressure, make sure to ask the patient if they are feeling any discomfort. If so, discontinue the treatment. If the patient is feeling uncomfortable, increasing or decreasing the height of the leg may help. When applying force, do so at least 3 times. Next, do clockwise and counterclockwise rotations. Ask the patient which is more comfortable. If the patient feels comfortable and is without pain, continue. Otherwise, stop the treatment. Please review the video to observe the correct way to perform these maneuvers. Chapter 9. This chapter goes over how to perform the Adams scoliosis test. Please review from your own training. Chapter 10. Stretching using a therapy ball. Have the patient place and hold the ball between their legs. Then, swing to both sides. Help show the patient how to perform this exercise and allow the patient to do it themselves. After at least 3 times on each side, have the PT or DC apply resistance 3 more times. Chapter 11. Pelvic Approach 2. Pelvic Approach. The PT or DC will palpate the PSIS and apply anterior and posterior traction. Keep in mind which height is most comfortable for the patient. Continue as long as there is no pain. Chapter 12. This is showing the physiological changes when the pelvic therapy is done on a skeletal model. Chapter 13. Leg and muscle stretching. Apply anterior and posterior pressure while the leg is extended. Have the patient do internal rotations and external rotations. Note to stop the treatment if the patient is feeling any discomfort. Chapter 14. Lumbar Rotation Stretches. Have the patient with their knees bent and apply clockwise and counterclockwise rotational pressure while using anterior and posterior force. Adjust their height so that the patient is comfortable. Increasing and decreasing the height of the leg will focus on different muscle groups. Chapter 15. Pelvic Stretch. Push the hip left to right while the patient is resisting in a neutral position. Next, have the patient slightly rotate about 45 degrees and apply similar force. Change position and do the same on the opposite side. Chapter 16. Loosening the lumbar, hip, and leg joints. Make sure to watch the video so that these maneuvers don't elicit any pain, and have the patient relax as much as possible.
Chapter 17. Shoulder and neck therapy. Here, the patient is set up in place. The shoulder strap is put on each upper arm, and you can adjust the height by using the pulley assembly. Adjust the top fastener for appropriate width distance according to the patient's size. Mobilize and provide therapy by moving the arm back and forth. This exercise is ideal for stroke patients. Neck cervical therapy. Get the cervical hook in place and adjust the angle by moving the top horizontal lever. Put on the cervical strap around the patient's head. Attach the cervical strap to the hook on each side. Apply the weight by pulling up the weight lock device. Provide the movement and therapy as appropriate. Patient should push the head against the provider's hand. Push the head back and forth. You can adjust the position of the locking device that results in a different pulling angle for the cervical strap. You can simply move the locking device in the desired position. You can use a different kind of harness as desired. Locking device position can be adjusted as appropriate. The recommended weight is between 10 pounds and 15 pounds, depending on the patient's condition. Additional support for anti-slip. Some patients can be helped by additional support to keep them in place and prevent slipping.